I'm going to be sharing with you evidence that multiple sclerosis is an infectious disease. We're actually going to be discussing different types of infections that cause multiple sclerosis. This is all validated with science, and I really hope that you help me to get the word out, to share this with practitioners, because it's time for change. Would you agree? If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 35 years ago. By the grace of God and a lot of work on my part, I learned about the different types, the main types of infections that are causing multiple sclerosis. And since that time, it's been 35 years now, we've coached thousands of people all over the world. I have a science degree. I do a lot of research. I've shared different articles and videos on some of the main infections. Today, we're going to summarize it all in one video today. Something that you can share with your chiropractor, your functional medicine doctor, any kind of practitioner that's willing to listen. We will be putting all my notes onto a blog post, an article that you can share also. And I'm also creating a resource for you so that you can actually start to ask questions and really get your practitioner, some of them that are open, starting to get them to question the status quo, how we're just gridlocked and we're stuck in this way of treating multiple sclerosis and other chronic diseases for that matter. So I have some wonderful slides. I'm going to go over to the slides and share them with you. There we go. You should be able to see my slides. So today I'm sharing with you evidence that multiple sclerosis is an infectious disease. We're going to talk about research of some of the main infections. They're parasites that cause multiple sclerosis. So this is a true image of microbes that live inside of our mouth, our nose, our throat, parts of our urinary and reproductive tract, but especially the digestive tract. We know that the surface area of the digestive tract is about the size of a double tennis court, and it is coated with microbes. It's just like a rainforest. And if we're healthy, then we would have a healthy rainforest and we would have many, many health-promoting microbes present. But there are certain circumstances in our life that cause us to become out of balance where we have too many bad microbes. So really, this is the most heavily researched topic in science today. We know that we carry at least 2 to 3 pounds of microbes inside of us, and we could have up to 10,000 different types of microbes living inside of us. Again, it's like an ecosystem. Our job, if we want to live a long, healthy life, is that we have to keep the population of the health-promoting microbes up. We have to learn that skill. We have to keep the population of the disease-causing microbes down, and we have to maintain a strong immune system. And the better that we are at doing these three things, the longer we will live and the better quality of life we will have. When we take antibiotics, it definitely helps to treat, usually it helps to treat the infection we're dealing with. Maybe it's a sore throat, maybe it's bronchitis, it could be pneumonia, strep throat, but those antibiotics, they also go after or destroy our health-promoting microbes, the ones that live in our digestive tract. And sometimes they're affecting them even more than the infection that we're taking the antibiotics for. So what happens is this really puts us out of balance, and as we are decreasing the health-promoting microbes, then the bad microbes that are left over that are not affected by the antibiotics, they have lots of room to grow. So normally we should have this thick layer of health-promoting microbes, and they produce all kinds of natural antibiotics, and they discourage certain bad parasites from growing. But again, the antibiotics, especially if you've used it a few times, and especially broad-spectrum antibiotics, very often before the age of 10 years old, it really disrupts that ecosystem. And then we have a point where the health-promoting microbes have been compromised. They're not we don't have that natural defense anymore. And then whatever parasites we're exposed to in our environment, we become susceptible for them to getting a hold in our body and becoming a problem, when normally our immune system and the health promoting microbes would keep them under control. So in this case, we would suffer with something called dysbiosis, meaning that we're out of balance. We have too many disease-causing microbes and not enough health-promoting microbes. And this is what happens in multiple sclerosis and all chronic diseases. Like usually for years we have symptoms before, and then there gets this breaking point where our immune system can no longer deal with these parasites, and our health-promoting microbes are not able to manage control either. So when we are dealing with dysbiosis, meaning we're out of balance, too many bad microbes, not enough health-promoting microbes, then we are susceptible to these chronic silent infections. And they're called silent because our practitioners, they don't have good tests to pick them up, and they haven't been trained in recognizing parasites. So we can have these silent infections for years, and we can notice a continual decline in our health even before we are diagnosed with multiple sclerosis or another disease. We know that these infections produce all kinds of toxins, alcohols, mycotoxins, neurotoxins, different organic acids and enzymes, and other substances. So the parasites themselves cause inflammation in our body, but also the toxins that they produce also cause inflammation. And inflammation means that our immune system is fighting something. Either it's fighting infection, the parasites, or it is fighting the toxins they produce. And when I say parasite, it's any microbe that lives in our body and causes us harm. So that would include worms and protozoa, fungi, bacteria, all those four groups. Those are the main groups of living microbes that would cause us harm, and we call them parasites. So this is something really significant. It can be everything from affecting our cognitive function, like this poor lady in the picture, our mobility, like our memory, our ability to sleep, our strength. So many different symptoms can be involved with these infections and the toxins they produce. There are at least 17 different ways that these infections cause inflammation and immune dysfunction. So our immune system it's kind of like a war that's gone out of control. It's managing, but these parasites do have different ways to make themselves blind to the immune system, so that the immune system is not dealing with them like they should, not totally eradicating. It's quite complex, especially when you can see there's at least 17 different ways, and probably more, but this is what we know already. So this is all, everything that I'm sharing with you is like science, it's well understood, but there's a disconnect between this science and our practitioners that are helping us, and that's the problem. So silent infections and dysbiosis are epidemic mostly because of the overuse of antibiotics. So for myself, when I was in my mid-teens, I was using, well, before then, we were prescribed different types of antibiotics for strep throat and bronchitis, etc. And then when I was in my mid-teens, I was prescribed tetracycline for acne for several months. That's a broad spectrum antibiotic, and there have been studies done. I have one in my book, Become a Wellness Champion, where they looked back on a very large group of people that had been diagnosed or prescribed with tetracycline years before, and I'd say at least 2/3 of them had chronic disease. So again, antibiotics do save lives. There is a place for them, but it's the overuse of antibiotics that has really devastated our health-promoting microbes, really put us out of balance. I believe this is the biggest factor. There are other factors in our environment that really are hard on our different health-promoting microbes, but this is the biggest direct assault on our healthy ecosystem, our natural defense that is supposed to defend us from parasites. So now we're going to talk about some of the infections that are associated that cause multiple sclerosis. So it's not that only one of them cause, but it's that when you have multiple sclerosis and other chronic diseases, these are really common infections, common parasitic infections that must be treated. So this is a picture of Candida. It's a commensal fungi. It's a type of yeast. It lives inside of our body. And when we have a healthy ecosystem, we have a lot of health-promoting microbes, then it is present in our intestines in the shape of a round seed. That is the non-disease-causing, non-pathogenic form of Candida. But when we go on antibiotics and then we start eating lots of carbohydrates, because for all parasites, their favorite source of energy is carbs, then this round cell morphs, it starts to grow roots. And the root structure is called hypha. And that is the more difficult form of Candida to treat. And Candida is, some of you may have heard of Candida before. It's a type of yeast. It's really common in people that have chronic disease, but even people that, are not even at the place with chronic disease yet. But we know that Candida can produce up to 70 different toxins. And again, it depends on the amount of fungal overgrowth we have in the body as to the degree of the symptoms we're going to deal with. So this is a true image of like the non-disease causing form of Candida, the round little yeast cells, and also the hypha. A lot of these different smaller parasites, they can also produce biofilms, and biofilms would be a slimy tent coating that they hide underneath. So on the left-hand side, that is Aspergillus. That's a type of a mold. That's a fungi that can cause sickness in humans too. And you can see the hypha, there's arrows to the hypha, and there's the biofilm is the ECM. So that's a slime coating. So the microbes, they will hide under this slime biofilm. They will create little communities underneath the biofilm, and nutrition can go in and fluid water can go through, so it'll feed the community under the biofilm, and they are protected from our immune system and from medications. So when we're recovering from these parasites, we have to understand that we should address biofilms also. On the right-hand side of this diagram, you'll see that that's a picture of Candida albicans. The ECM again is the biofilm, and you can see the hypha. Another type of infection that causes multiple sclerosis symptoms and is involved with causing MS would be filarial worms. So these are very, very small roundworms. They are the immature form found in the central nervous system by Dr. Alan MacDonald, a pathologist, a very well-respected pathologist. And you'll see this is one of the images that he shared, and you can find his lecture on our website, livediseasefree.com. If you go to the main menu and you look at research, MS is an infectious disease, go underneath parasites, you'll find his lecture there, a link to his lecture. And it's really important to watch that, and I would really encourage you to share that lecture with different practitioners. It's ridiculous that this has not gotten traction. It's ridiculous that his work has not been further studied to refute him or to agree with his research. This is something that is so huge because veterinarians have known for over 100 years that when these roundworms enter the central nervous system of domestic animals, they have all the symptoms of multiple sclerosis. And Dr. Alan MacDonald found many, many worms in the spinal fluid of every MS subject tested. He found them mating in clusters, eggs, larvae, lots of the guck, the waste material from these worms. And yes, they can cause a lot of damage in the central nervous system. What's really fascinating also is that he found Borrelia in the spinal fluid in the central nervous system of MS patients, and this green fluorescent dye is attracted to the DNA of Borrelia, which is the bacteria that causes Lyme disease. So you can see here in this image, there's one worm that the red arrows point to, and the other the blue arrows point to a second worm, and all of that green fluorescent dye indicates genetic material from Borrelia. So Borrelia is the bacteria that causes Lyme disease present in these worms. So these worms have their own parasites. And it's bad enough that these worms get into our central nervous system and cause damage, but they are also infecting us with Lyme disease. This is a poster of his research. You can find it again on our website, and you can find it online. It's a great summary to share with practitioners because it just shows a whole bunch of pictures of what he found, a summary of what his study was about. And his study did not cost millions and millions of dollars. We can study this, and it doesn't have to cost millions and millions of dollars. So this is the frustrating part, is that normally with research, only pharmaceutical companies only want to research things where they can see a huge profit, right? Where there's going to be more patentable, brand new patentable different types of medications, treatments. But to treat parasites, there's no money in treating parasites. And so to look for parasites in humans is really not financially feasible. Like, it's just not worth it for these companies. So who is going to do this for us? Like, I thought our government or somebody, like, is there anybody that's going to look into this? 10 out of 10 patients or subjects that he found, these were people that had confirmed cases of multiple sclerosis. They died. Their remains were in brain banks. So it is confirmed cases, like very legitimate. And he found tons of these worms in every single case of multiple sclerosis. That should be followed up. And this was done several years ago. Dr. Alan McDonald also found tapeworm larvae and developing tapeworms in the central nervous system of these subjects. So I think 2 out of 10 he found developing tapeworms. That's pretty scary, actually having a worm develop. But he also found larvae from the tapeworms in every MS subject in their central nervous system. And from my research, what I'm seeing is that it may not only be tapeworm larvae. He didn't look for every single type of parasite, but we know that a lot of our MS students that we're working with, they have a lot of roundworms. So the roundworm larva, the baby, the immature form of the roundworms, they move into tissue, they move into the central nervous system. Flukes do also, tapeworms do also. So we know that the central nervous system is not a sterile environment. Microbes can get into the central nervous system, and that's why we need our T cells and our B cells to protect us from different types of infections. We should not be suppressing our immune system. That's like suppressing your soldiers when there are enemies all around you. You don't do that. That's very dangerous. So please share Dr. Alan McDonald's posters, the one with the filarial worms, the one with the developing tapeworm and the tapeworm larva. So please share all of this research. It's really, really important. And then Borrelia is the bacteria that causes Lyme disease. And what's been so fascinating is that, like, very often scientists, they'll find a certain bacteria, and then they can look back and go, well, there's another bacteria that's part of the same family, and we know how that other bacteria behaves in the human body. So then they have a better understanding of how the newer bacteria, they don't have a lot of research on. So Borrelia is the bacteria that causes Lyme disease. It's like a corkscrew-shaped bacteria. It also belongs to the same family as the bacteria that cause syphilis. Syphilis has a primary, secondary, and tertiary stage in the body. That's kind of like, when you first get infected and then maybe you're dealing with it for a while, and then tertiary is kind of when it's a more advanced chronic stage. And the tertiary stage of syphilis can affect many different organ systems, including the brain and the central nervous system. So when this corkscrew type bacteria that is related to Borrelia, they're like part of the same family, when the one that causes syphilis, when that gets into the central nervous system. They call it neurosyphilis. These are a few symptoms of neurosyphilis: severe headaches, seizures, muscle weakness and or trouble with muscle movements, spasticity, tremors, trouble focusing, confusion, dementia, problems with memory, thinking, or decision-making, depression or irritability, changes in vision, blindness, hearing loss, tinnitus, loss of bladder control, incontinence, dizziness or vertigo, numbness, paralysis. Gee, a lot of these symptoms sound like multiple sclerosis, don't they? Or other neurological diseases. So there's a lot of overlap. What is so fascinating is that there were a lot of studies linking multiple sclerosis to these spirochete bacteria. All the way back 1911 to the 1950s, many researchers believed that MS was caused by a spirochete-type bacteria because of its similarity to other diseases caused by similar types, the spirochetal bacteria. And there are many MS spirochete references before World War II and going back all the way to 1911, and some of them published in prestigious journals like The Lancet. To learn more about these studies, to find the titles of them, you can go to our website, livediseasefree.com. Under the main menu, go down to research. MS is an infectious disease, and there you will find a list of studies. You can go through them. So these are just a few of the studies. So 1911 spirochetes, they were finding spirochetes in multiple sclerosis patients. 1917 spirochetes, the cause of MS. 1918 simmering spirochetes in MS by dark field microscopy. 1922 spirochetes in the cerebral spinal fluid of MS patients. 1928 spirochetes in the human brain of MS patients. 1933 spirochetes in the cerebral spinal fluid of MS patients, another study confirming that. 1939 spirochete-like formations in MS. Like, what happened? There was all this research being done, and then everything gets dropped. Around the 1950s, 60s, somewhere in there. We'll talk about that later. 1952, acute plaques in MS and the pathogenic role of spirochetes as the etiological factor. So they're linking lesions, plaques or lesions, to these spirochetes in 1952. And I don't know if I got the 1948 spirochetes within the ventricle fluid of monkeys inoculated with human MS. 1950s, Steiner found spirochetes in the brain lesions of autopsied MS patients. Again, like 1957, Time magazine reported that a specific bacteriologist scientist successfully cultured a spirochete microbe that she found in the spinal fluid of MS patients, and she believed that MS was caused by the spirochete, and early treatment could lead to an improvement of the disease. Isn't that interesting? So what happened? Like, we knew more about what caused MS back in 1911 than we do in 2025. What happened? Like, seriously, it drives me crazy. Sorry, I've been doing this work for 10 years, and it is so slow to get things to change. So this is an amazing, like, Dr. Alan MacDonald should win a huge prize, a Nobel Prize, for the work that he's done. These are some images of, like, you'll see the center where it's kind of bright. It looks kind of like on the left-hand side, like a sun. But those are cross-sections of nerve cells in Alzheimer's patients. The green squiggly things are Borrelia, the bacteria that causes Lyme disease. So he is showing that Borrelia can infect the myelin sheath of nerve cells. So we know that MS is a demyelinating disease, and it's like, oh, our immune system is just going after the myelin sheath for no reason. But here is actual proof that there is bacteria that can infect the myelin, and do you think maybe the immune system would go after bacteria in the myelin or close to it? Do you think that it would? That's its job, is to go after infections. That is its primary job, is to defend us from infections, from parasites. So this is really something that every person should take to their doctor. I will take pictures of this. I'm going to put this, I'm creating different resources for you to share with your practitioners. I can't do this by myself. You guys need to just share this with anyone who will listen. We have to bring change. We have to bring the truth out. More and more people are starting to realize that parasites are the cause of their terrible symptoms, but we know so much about the types of infections that we're dealing with multiple sclerosis and other chronic diseases. And so we can fast track people to get help, to get recovery, by helping the practitioners to have a little bit more experience and knowledge with what we've learned, so that they can target specific infections that are commonly found in MS or other diseases. So this is golden. This slide is just so golden, because it is like showing you that bacteria are found in the myelin of nerve cells. Yes, that's in Alzheimer's patients, but Dr. Alan MacDonald found that Borrelia was found in the central nervous system of MS. So if they're in our central nervous system, do you think they could be a problem in our myelin also? Absolutely. So the National MS Society, they're trying to differentiate. This is something that was taken off of their website. I did take a screenshot of it. So this was on their website, and I don't know why they took it down from their website, maybe because it's causing too much confusion in people. But there are so many people that, and even there was a practitioner that reached out to me today. They're writing a book about misdiagnosed MS, and it's actually Lyme disease. So there's this, a lot of people thinking that, you know, like, no, I don't have MS, I have Lyme disease, or either or. But what the reality is that when you have MS, you could easily have Borrelia, right? Dr. Alan MacDonald found it, but there's more to it. It's not just Borrelia that's a problem. But the MS Society has gone out of their way to kind of try to make people think that, oh, no, MS is different. MS is very different. It's like, it's not the same. Don't go there. So what they shared is that Lyme disease can cause neurological symptoms similar to those seen in multiple sclerosis, such as weakness, blurred vision, caused by optic neuritis, sensations like itching and burning and stabbing pains, pins and needles, confusion, cognitive dysfunction, fatigue. Lyme disease symptoms can also have relapsing remitting. So they're like, okay, Lyme disease and MS, they can have very similar symptoms. And then they go on to say, oh, and they can be relapsing, remitting courses, both Lyme disease and MS. And then they go on to say that the testing, that looking at spinal fluid and looking at MRI scans, that those are also very similar between Lyme disease and multiple sclerosis. So, but then they go, but they're different. So the testing is often the same, the symptoms are often the same, the way that the disease, the conditions go relapsing, remitting are the same, but they're different. And the reason they're different is because they say that with people that have multiple sclerosis, antibiotics don't help, but people that have Lyme disease, if they treat early enough, the antibiotics help. Well, I have shared, please, if you want to learn more about this, maybe you have been working with a Lyme literate doctor and you found out you have MS, look for Live Disease Free and look at Lyme disease and look for different articles and videos, because I've gone into much more depth on this topic there, where the actual MS Society, on this page they're saying, no, they're different. But then on other pages, they have funded studies that show that antibiotic use early on actually helps MS, like from the first clinically isolated attack or syndrome to stopping the MS, like within the first few months, if you go on antibiotics, it helps. I don't believe that it's the answer, because as I'm sharing with you, antibiotics, that's probably the biggest reason why many of us have chronic disease today, because our doctors, they wanted to save our life. They thought they were giving us antibiotics to save our life, but they did not know that they had to correct the microbiome to defend us from other parasites, and they don't know how to identify or treat parasites, other ones. So the MS Society has funded different studies that have shown that antibiotics do help MS patients, especially in the first early stage of MS diagnosis. There's another infection that's commonly associated with multiple sclerosis, and this is it's called malaria or babesia. So I don't know which one it is because we're not testing, but malaria, the Plasmodium protozoa that causes malaria and the protozoa that causes babesiosis, they are single cell parasites that infect red blood cells, and malaria is known to cause a demyelinating disease in the central nervous system. And I'm just going to talk about malaria here because they're treated the same. They have very similar symptoms. And in time, we will know if it's always one or the other, or if it's a mix of some people have one and some have the other. So there's about 75 scientific studies, again, dating back to the 1880s, where a malaria-like organism was discovered in MS patients. And I've done at least a 6-part series on MS and malaria. Really, really fascinating. Make sure to look through that on livediseasefree.com on our blog posts. Our blog posts are a literal gold mine of research and insights to really help you if you're sick and you don't know why, to help you to understand what's going on in your body. And it's not just MS. People that don't have MS, but maybe they're dealing with other scary symptoms and they don't know what kind of disease they're going to get, and they just start to go through my stuff and they're like, oh my gosh, this makes so much sense. And it's just like light bulbs go off. It's amazing. So again, 75 scientific peer-reviewed papers dating back to the 1880s finding these malaria. So they're not a bacteria, they're a single cell protozoa parasite in MS patients. In 1899, researcher Manneberg believed that MS was caused by a malaria type of infection. MS patients treated with anti-malarial drugs, it was quinine at the time, in the 1920s and early 1930s had significant symptom improvements, and some of them were like virtually symptom-free. So there was a malaria outbreak in the United States back at that time, and so they were treating people with this malaria drug, quinine, and people that had MS, it was like, wow, you have this extra benefit if your symptoms are going away by using this drug. And then more recently, Dr. Fry from Fry Laboratories discovered a new type of protist in MS patients. And in 1921, and I did a talk on this, there was a study released showing that hydroxychloroquine, which is a malaria drug, helped primary progressive multiple sclerosis. So with progressive multiple sclerosis, there really are not really a lot of, well, I don't believe any of the MS drugs are very helpful anyhow, but they don't really use them for progressive multiple sclerosis. But they found that hydroxychloroquine significantly helped at people with primary progressive. So make sure to go back to livediseasefree.com and just do a Google search of malaria, or maybe the new study of, malaria drug helps PPMS. You'll find our article there and you'll find my breakdown of it. So again, what happened? Why did all of this get lost? Like, if this all happened, late 1800s, early 1900s, and then building up to the 1940s and 50s, and then everything gets dropped, what happened? Like, how is this possible? It's so frustrating because people that have MS, they suffer so terribly. They don't live their life. They are disabled. They're like sitting on the side. They're in constant pain. Their muscles are spasmed. They're on all these drugs. They have terrible cognitive function. It's living hell for people. The MS drugs don't work because they're attacking the immune system. And people are ending up in care homes. Like, even when they're young, missing out on their whole life because all this research got dropped. You have to help me get this word out. You really do, because it's time for change. There's a lot of things going on in the world where things have to change, and this is one of them. So, oops, I forgot to warn you. I'm sorry. I'm going to share with you now our students. They are passing a lot of big worms. There are roundworms, there are flukes, there are tapeworms, and we used to think when I was first diagnosed that it was all candida. Like all the books I read were about candida. They did talk about parasites, but they didn't know how many parasites we have, the bigger worms. And then there's herbs in the health food store. So there's like black walnut and clove and wormwood combinations that you can purchase. And you might pass a worm or two, but we had no idea how infested people are with these infections. And yes, and it's like to the point now where I'm like, I don't know which of the parasites are causing most of their symptoms, because when they're passing these huge worms, it's like so dramatic in the improvements in symptoms. And I'll talk about how we do this in a few minutes. But I apologize for sharing that picture. It's kind of scaring you. But I'm going to share with you pictures of worms that our students have passed. I have hundreds and hundreds of pictures. People that are really infested, who have chronic disease, very often they can document over 200 worms, and they may still not be done treating. That is how significant. And you might be skeptical, thinking that can't be, Pam. But if you think about your intestines being the surface area of a double tennis court, then you can start to understand that there's a lot of room for these parasites to live and grow. And that is the case. So I'm going to share with you a picture. I hope you look at it, because you probably have some of these worms, even if you don't have chronic disease. So these are just a few pictures of worms that our students have passed. Again, like, what I think from all the people we've worked with is that, and I don't have a picture of a fluke here on this image, but intestinal flukes are really, really inflammatory. And so are the roundworms too, but I think the flukes are worse. And I do have an article and a video on intestinal flukes at livediseasefree.com. You can see a whole bunch of pictures that students have passed. And I don't know if they are liver flukes or intestinal flukes, could be one or the other. Some of the liver flukes can be quite large also. We can also have smaller flukes that are blood flukes. So flukes are incredibly pro-inflammatory, even more so than the worms. But these are just a few and people that have Lyme disease that don't even have MS, they have a lot of worms also. That's been our experience in our students that have had Lyme disease, worked with Lyme later doctors, went on antibiotics for long periods of time, weren't getting better. They found us, they started treating larger parasites, and then they started to get better. You can't clear Lyme if you have other parasites that keep infecting you with Borrelia. So this is the strategic plan that we have, the Live Disease Free plan. And there are 4 main steps in this plan. The first one is to weaken the parasites and feed the body. So step number 1 and step number 2 are part of the prep phase. We're getting ready to treat. It's very wise to prepare to treat. If you just start treating, you will feel horrible. So we follow the Live Disease Free diet. The guidelines are on our website, Live Disease Free, under research. It is low carb. So we are decreasing the carbohydrates significantly, because that is the favorite food for the parasites. So they become less active, they produce less toxins, and the inflammation starts to go down. We start to feel a lot better. That is the first step. It is foundational. It is so dramatic, the difference that people can feel with just diet, as far as sleeping at night, strength, less spasticity, having more clarity, mental clarity, the brain fog going away, energy, on and on. Just that is a huge part of immune modulation. The second step is to support the body. So this is done with, number 1, making sure that we are having daily bowel movements, making sure that we are sleeping at least 8 hours per night, looking at our blood work, supporting our physiology, a lot of other things like cleaning up our environment of mold and radiation. Just those are some of the bigger ones that we start with. And so when you do step number 1 and 2 and you're feeling a lot better, then you start to go after these parasites. And so when treating these parasites, we work big to small. We work in cycles because some of these worms can lay 200 eggs in a day or more, 100, like thousands of eggs in a day. Depends on the type of infection, type of parasite. And so we have to understand we're dealing with biofilms. These are very, very hardy. They're laying a lot of eggs. There could be larvae. There could be dormant eggs inside of us. So we do cycles. And we will normally treat the larger parasites for 10 to 14 days. So the protozoa and the worms and protozoa for 14 days. Then we will treat the fungi for about 10 days, and then we will take a break week. And during that break week, we will still continue with herbs and oxygen therapies, etc. And we will be hitting more of the bacteria. Maybe if the students have had more of a Lyme history, they'll use liposomal herbs, which are emulsified in fat, which will go deeper into the tissue and cross the blood-brain barrier a little bit will. Or if they have more candida history or mold history, then they might use herbs and or therapies, natural therapies that are more geared towards antifungal properties. And that would be one treatment cycle. It's about a month, and students test well for at least 3 to 5 parasite drugs. So I'm seeing all over that the awareness to parasites is increasing. People are experimenting and they're going on 1 or 2, using a protocol. Like some practitioners are trying to help, but they're recommending like 1 or 2 drugs for everybody. If you really want to get well, you have to make it tailored to what you're dealing with, because not all the parasite drugs will treat all parasites. Certain parasite drugs will treat roundworms, others will treat flatworms, some will treat protozoa, right? Some different herbs will treat bacteria. So you really have to use a tailored approach to the types of infections you have. And you might be wondering, well, how do we figure out what infections we have? Because we don't have good stool tests. So what we are using right now is we're using energy testing results. So our students will take 1 sample of the commonly prescribed parasite drugs to either a chiropractor that does applied kinesiology, or a naturopathic physician or doctor that does some kind of advanced muscle testing, or they might use a machine for energy testing. And so they're able to pick up changes in our energy field. This is biophysics. And they can tell if there's a treatment that strengthens us or doesn't help at all. And so with that, they're able to give us a list. And how we decide, and working with practitioners, etc., how the treatment plan will be for a person is based on their health history, the health history of their parents, their diagnosis, symptoms that they have, and energy test results. And they're also doing these enemas using an oxidizing agent, an oxygen type agent. And so that's helping them to pass worms, and they're documenting what they're passing by laying it out on tinfoil or parchment paper. You'll see them in our blog posts. I've got one on roundworms that MS patient or students are passing, also flukes. So you can see some of the different types of parasites that they're passing and how they're like, don't put it on paper towels or toilet paper because they stick to it and then they fall apart. If you lay the parasite on tinfoil or parchment paper, put a ruler beside it, then your practitioner will know how big it is, right? And if it's long and skinny like a noodle, it's probably a roundworm. If it's flat and long and like a ribbon, a flat ribbon, and maybe you can see segments in it, that would be like a tapeworm. If it's shorter and wider, maybe it's 2 to 4 inches long and it's maybe a centimeter wide, flat, that's a fluke. So that really helps. So then when we look at, okay, these are your energy test results, is that consistent with what we're seeing you're passing from your large intestine? Remember that a lot of the parasites like to live in the small intestine, so you can't get them out with an enema, but if they're in the large intestine, you will reach them. So then, as we are treating over cycles, every cycle we are getting better and better and better, feeling symptom improvements. And we can never promise full recovery, but what we can see is that if you treat these infections, these parasites that cause MS and other diseases effectively, that you will have more recovery than you ever thought possible. So we have had students that for 40 years, 40, they could not use their hand. It was like clenched tight. And then all of a sudden, one morning they wake up and they can move their fingers. And then they start to do physio and they're able to use their hand again. People that have been in a wheelchair for many years, we can't promise full recovery, but maybe after a few treatment cycles, maybe even a year of treating, we are getting better and better all the time at treating. And so then they can start to stand, and sometimes their drop foot just starts to loosen, their ankle loosens, and then they can start to work it and they can start to stand up. So they are taking back their mobility. And the exciting thing is that there is so much that is in the inflammatory stage and not the permanent scarring of the myelin sheath. So when the nerves are permanently damaged with scar tissue, that cannot be reversed. But if it's still inflammation, that can be reversed and people can have a return in function, in mobility. And we see that a lot. So this is another reason why we need to get going with this. We need to get this out to people. We need to get practitioners trained up in this and share this with them. It's not hard. Like it would save so much in our healthcare system. Our healthcare system is like a multi-trillion-dollar industry, and we are sicker now than we've ever been before. We're more obese. We have more chronic disease. It's all on the rise. More money is not the answer. Treating the root cause is the answer. And the root cause that has been ignored, and I believe at the top it has been ignored intentionally. That's just my humble opinion, because if I can find all this research, it's not that hard. It's all available to anybody. I'm sure they know, but there was there was something that happened in the 1950s to 1960s. At that time, where there was this building up of all this research showing that MS, that different infections were causing MS, all of a sudden, our practitioners were starting to be taught about autoimmune disease. So before that, all the doctors felt that chronic disease was caused by infections, and they were looking for which infections were causing disease. And then all of a sudden, there was a shift by a very expensive group, very rich group that had a lot of influence on our medical system. And this is where our doctors started to be trained on autoimmune. Everything is autoimmune. We don't know what causes any of the autoimmune diseases. It's just our immune system is attacking our tissue and various diseases, different tissues, for no apparent reason. And we've been stuck in this horrible, horrible gridlock of our healthcare system for many, many years. So now we have over 80 autoimmune diseases, which is really, really sad. So as we are treating these parasites, then we are getting healthier and healthier and healthier. And when we become symptom-free, then we have to make sure that we continue to manage the health, these microbes in our body. So treating these parasites is one thing, but we do want to build back our healthy ecosystem. We want to build a healthy lifestyle. We want to do like heavy metal detoxes, liver, gallbladder flushes, all those wonderful things. But if you don't treat the parasites, you will not recover from MS, because MS is not caused solely by heavy metals or immune system attacking itself for no reason. It is an infectious disease. The primary job of our immune system is to fight infections, to fight parasites. So because you live on planet Earth and I live on planet Earth, we are going to be exposed to parasites again in the future. Obviously, I haven't been on antibiotics since I was probably like 16 years old. I haven't needed it because I know how to do things so that I don't get these secondary bacterial infections and I don't have acne anymore. So I'm not devastating my ecosystem, not eating bunch of sugar. I'm not eating any sugar because I don't want it. No alcohol, no caffeine. I just don't need that. I have a second chance at life. I have a very full life. I have 7 grandchildren. I'll have 8 pretty soon in the next few months. We have animals. I'm coaching many students. So my life is full, and I am so grateful to have a second chance to live again. So that is why I have made choices that I don't miss it. I don't want it. I don't want any of that stuff. So this is maintaining health. Keep building up the good, and just basic health promoting practices, being active, balancing your stress, all these things that we know of, they're all still important. But the biggest missing piece of the wellness puzzle to recover from MS is to treat the parasites, treat the infections that cause multiple sclerosis. So once we're well, then we have to make sure that we treat periodically, right? We have to make sure that as we're exposed, and I think that the best way to do this is, like, if you're super healthy, you have energy, you're sleeping well, then you're probably quite imbalanced. And like your cognitive function is like your clear mind, no depression, no anxiety. You just feel good. That your microbes are probably in balance. But if you notice that you have some gut issues, you've got some gas or constipation or occasional diarrhea, or you wake up throughout the night, maybe you're feeling a little bit more depressed, maybe you have a little less energy, maybe you feel like you have anxiety, you can't skip up the stairs anymore. All of those signs are allergies, right? There's just so many little warning signs that we had years before we got a diagnosis of chronic disease. And if our doctors would have been skilled at this, they would have said, we would have complained of them, and they would say, sounds like you need to do a parasite cleanse, and we will figure out which ones you need or which treatments you need, and they would have done it right away. And if they would have treated the parasites early, we would have avoided getting chronic disease later, because we would never allow ourselves to become that infested with parasites. I'm going to go back to see your questions. Okay, here we go. I just have to move this out of the way. There we go. Awesome. So I just want to move this here too so I can see your questions. Where is it? There it is. Great. So I will take a couple of minutes to answer some questions. I have to leave here pretty quickly, but do you consider autism an infectious disease? You have a toddler with autism that is being treated for parasite and gut issues. Yes, definitely parasites, their microbiome is out of balance. That's one factor. There can also be vaccine injury, but they all have different parasites that they're dealing with for sure. There is a really wonderful colleague, Carrie Rivera. You may not, I don't know if you've heard of her or not, but you won't find her on the social media platforms. She has been silenced. She used to help thousands and thousands of families that had children, that have children that were dealing with autism. And her son, actually, she's a homeopath, and her son actually had autism. So you can find her work just if you look up Carrie Rivera. She's an amazing, amazing person. So the oxygen therapies really help, and certain herbs help, and also maybe sometimes some of the medication, but usually they're using medications that are more working just in the gut, not systemic, not metabolized by the liver, but definitely gut issues are really involved a lot with autism. Hello, Michelle. Should I add that a chiropractor, maybe I'm going backwards here. Let me just see. Oh, there's quite a few questions. I'll start with Dan. Dan sent in stool samples and no parasites were detected. High levels of fungus markers and candida. Could this be the reason for MS diagnosis and MS progression? No, I don't believe that at all, because the reason is that we have served like hundreds and hundreds of students, well over 1,000 students. We could be getting to 2,000 students by now. And we will do like treating the roundworm, or not the roundworms, but the worms and the protozoa for 14 days, 10 to 14 days, then fungi, and then we will be treating just like with herbs and taking a break from the medications. During the fungus treatment part, we don't see a lot of shift in symptoms. We see a lot of shift when people are passing the big worms. And sometimes when they're treating Lyme with the like the babesia or the malaria or the Borrelia, when they're using the liposomal herbs. So yes, fungus is definitely something we treat, but when your doctor is just looking at candida, and we don't even do tests for candida because you can tell if you have symptoms of candida, but if your doctor is just only focused on that, they're back in the dark ages. Like when I was diagnosed with MS, that's what the doctors were talking about. Those were the books I read about, was MS was caused by candida, by fungus. And yes, fungus is present in a higher amount when your immune system is suppressed. So if your immune system is suppressed from different types of parasites, then the fungus is going to be more active. If you have a lot of different parasites and they're dropping off or their waste material into you, you're releasing their dead bacteria that they have living inside the worms. All of that's going into your blood, into your tissue. Fungus is the recycler of the world. It likes to clean that up. So fungus will be more present in us when we have a lot of garbage. And a lot of the worms live in the intestines. So yes, they will be there. The fungus will be there in the intestines, but it also moves into different parts of the body. So we can notice that we have fingernail, toenail fungus, we can have dandruff, rashes, all kinds of other symptoms of fungus. But we have not seen that it's life-changing when people are using the fungal drugs or the fungal herbs. We notice that diet is really important because fungus loves sugar too, so getting the carbs down, but that's with all the parasites. So that's really important for you. How much did the test run? I personally would not do a parasite test. We don't recommend parasite tests for our students because people can spend $500 to $1,000 plus and it's not going to show. Like if you're in a place where it's covered, where your stool analysis or comprehensive stool analysis is covered, you've got an extended care plan, you can get that done, but just don't be discouraged when they don't find anything. It's so bad that where I live in Canada, that people have put worms in their stool sample that they have passed, and they send the sample in and they don't even see it. And I don't understand why. I think that they just go through a procedure where they just dump it and then they spin it and then they just take the liquid and they're looking for protozoa. That's what I'm guessing, but they miss it all the time. Hi, Mel. So you were born with asthma and all of the related lung issues, bronchitis, allergies, hay fever, that you can name, frequently treated for those. So if you had asthma, that is considered a chronic disease. And that can be, fungus definitely can be linked with that, but other microbes also. We used to always think that so there can be lungworms, there can be just even the amount of dysbiosis in the gut that really impacts your immune function, and then you can end up with, fungus growing or other bacteria or lungworms. There's so many different parasites that can cause similar symptoms, and that's why it's really important to be energy tested. That is more helpful if it is a good practitioner. You don't have any more asthma, you haven't used a pump since you were 11 years old, and that's the first time in your whole life you didn't need a pump, or no allergies, no hay fever, no sniffing, runny nose, or nothing. That's awesome. Landing in Atlanta, the MS kicked in, all the lung issues kicked out, including allergies. So look into the parasites because that is honestly what you're dealing with. So it's not just candida, it is other microbes. And so I first learned about candida, then we learned about the Lyme infections, then we started learning about the different types of worms, And it's really shocking. Like, I went to university, I didn't even learn much about flukes. We maybe spent a minute or two talking about them because it's always like, oh, that's in Asia. But now we found out that there are blood flukes in our lakes, just in British Columbia, Canada. So in your areas, if you're swimming in water, wherever there's swimmer's itch, that is a blood fluke. So there are parasites all over. They're part of life. If you have animals, if you like to work in dirt and soil, if you walk barefoot, different places, if you eat produce, if you eat meat, if parasites are part of life. And the problem is that our healthcare system, our standard of care has ignored this, that parasites are part of our environment in the developed countries. And this is why we have the epidemic of chronic disease today. And this is why it's just getting worse and worse until we get our system to be an honest system. And then Mel, you wonder, let me just see here. So Michelle said, I have had chronic symptoms for 7 years and recently learned that I had severe Babesia infections in the central nervous system. You took the Cellcore Babesia supplement. Is that enough? I don't believe it is that enough. That's not enough. I'm familiar with the Cellcore products, and there's lots of different herbs that you can use for Babesia. It depends. Like this is where I don't know enough about you, Michelle. Like if you have a lot of other symptoms, so neurological symptoms, gut symptoms, the problem is when you have something like Babesia or Borrelia, they usually don't become a problem in people unless they have a lot of other parasites. So if you have a lot of other parasites, then when you are infected by a mosquito or by a tick, and you get those vector-borne infections of Lyme disease, like most people don't show the symptoms, but if you do, then it's probably not just Babesia. That's the problem. And in our students, like Babesia is pretty challenging to treat, but with antibiotics, like it's definitely difficult to treat. What you have to do is you have to do multiple things. You've got to treat it like holistically. You have to make sure that you treat other parasites too, because if you just focus on one parasite, you're not going to have the quality of life that you want. You have to treat like the variety. You've probably got worms, you probably have bacteria, and the Babesia, if you have that, that's a protozoa. And usually people have fungal overgrowth. So we treat we knock all 4 categories of parasites down, and we keep treating them until people are completely symptom-free for several months, maybe 2-3 months. And then they can start to reintroduce a little bit more carbs, not go really high carb, but just starting to test things. And if you have treated well enough, long enough, then you can start to bring the carbs up and you won't notice any difference because the burden has been decreased so much. You'll only notice when you eat more carbs and you feel worse is when you have different types of parasites. So the Cellcore, you can try it, and if you might feel that you're a little bit better and that might help you for 6 months and then you feel worse again, you really need to do a more holistic parasite treatment. Thank you for all your kind words. So you have MS. Last 2 questions. And so Michelle, I should add that the chiropractor muscle tested me as well for the Babesia supplement. That's good. That's awesome. But you're probably missing other things. You can try the Cellcore first and see if that helps enough, but if it doesn't, then just doing all the steps we do. Sorry, I've been talking a lot. My voice is getting a little off here. Let me just grab some water. Oops. Okay. I have long COVID, fibro, chronic pain, Lyme, September. of late treatment of antibiotics. Now you have MS symptoms. What do I do? I would personally watch my masterclass training, because on my training, I go into more detail about all the steps you need to do to recover. So you do need to address the long COVID. There are certain things you can do to address that. And then also you need to address all the different types of infections you're dealing with. Remember, it's like dysbiosis. If you have a lawn in front of your house and you don't water it, you don't take care of it, then weeds move in, right? And it's not just dandelions that move in or thistles. You get all kinds of different weeds. And with multiple sclerosis and Parkinson's and ALS and PLS, we have a much higher burden of parasites. So when you're starting to get symptoms of MS, that means that the burden of parasites are getting quite high, and that means that you need to address it very seriously. So make sure to watch my masterclass training, go through all the steps. If you need support, if you don't have a doctor that will help you with a proven treatment plan, you can chat with me, you can join our program, you can join our students that are recovering from all over the world. They do most of the work themselves. They do access practitioners for certain things, but I help them with everything. So you really have to treat this. Otherwise, what's happening is that the COVID suppresses our immune system even more. So if we had a lot of parasites and then we got COVID, then it's kind of like another straw that breaks the camel's back. All right, keep typing your questions in the question box, and our team will answer your questions. I will be back next week. If you need support, make sure to watch my masterclass training. You can learn more about our Live Disease-Free plan. I've given you tons and tons of resources on our website and on our blog post, even under research. Start to do some digging, learning if this is all new to you. And then if you like what I share, and please help us to get the word out. So like, share, and subscribe, and I will be back next week. Take care and bye-bye for now.